So one of the most frequent comments I hear from people about fasting is that they get some indigestion. They're fasting for 12 hours, for 16 hours, for 24 hours, or even some of the extended fasting. And so they're starting to feel a little burning in the stomach. They're starting to feel a little irritation in the chest. And so we're going to talk a little bit about indigestion while you're fasting. Hey, if you're new to me, I'm Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health in your life, avoid complications, and go to the next level. And in this year, new you. I'm talking to adults with type 2 diabetes who want to put their diabetes in remission, who want to get off of diabetes medications, who want to improve their metabolic health, who want to reverse their diabetes. That's what we're doing. And I've been using an amazing tool called fasting. If you've been following me, you know that. And I am right now 90, let's see, 10, 11, 12, 1. So I am right now 93 hours, a little over 93 hours in terms of a fast. That's right. And you're going to get to see me here in just a little while eat something for the first time in 93 plus hours. And as we do, as we do here on the show, you're also going to get to see what my reports are showing that I've got off to the side. I've got my meters here on the side. We'll see what my blood sugars are, what my ketones are at 96 hours. That's right. That's right. That's how we do it here. So first, let me go ahead and do our check-in as we do. And we're talking about how I'm feeling physically, mentally, and emotionally. And physically, right now, feeling pretty good. I am, as I've mentioned before, I am a little tired because there's a lot of stuff that's been going on this week. I've been staying up late. There's a program that's going on at our church. And so I've been working with them and then coming here and hanging out with you guys and getting up early in the morning and, so all those things that happen. And so this week I am feeling a little bit more fatigued than I normally do during the fast. In terms of my mentation and how I'm feeling mentally, I think I'm pretty clear. Even though I've been sleepy, I think yesterday I mentioned that I was feeling a little slow. But today, actually feeling well. I got some good rest last night because remember, that is a key to being able to get through a fast successfully. And so last night I got to bed and I slept like a baby, y'all. I slept like a log and woke up this morning feeling pretty good. And then emotionally got through the week and am energized because I've been able to make it another week during the fast. There are a lot of cues around me. Remember that habit, emotions, access, and taste? There are a lot of cues around me. People were eating, and so I started my fast Monday, so Tuesday, Wednesday, today's Thursday, and here in just a little while, we would have made 96 hours. But I'm going to break the fast because I don't want to do that at 3 o'clock in the morning, and right, so we're going to pick up and go from there. But feeling emotionally good. I'm feeling energetic, feeling satisfied, pleasant, feeling happy. Got through the week, did a lot of things that I wanted to do this week, even though it was a busy week. That's right. All right, and I see, so Jennifer is out there. Jennifer said, hello. She says, wow, just left another channel and have you popped up. Hello, Doc. Hey, Jennifer. Glad that you are here hanging out with us tonight. I see a bunch of folks that are over on Instagram. Thank you for joining us. Let's take a look at what my blood sugars are right now on my continuous monitor. As you know, I have two monitors, one on either arm. I've got a Libre 3 and I've got a Dexcom G7. And you'll see right now on my Dexcom that my blood sugar is 59 and has been hanging out below 70 all day. So look at that. All the graph is there. Also for my Libre, this is my Libre 3. You'll see early in the morning there was a break, and that was when my Libre expired, so I had to put one on. But for most of the day, it also has been kind of hanging out below 70. And often people ask me, do you feel that? And I actually don't feel it. We're in the process now. We're going to take a look here in just a little while to see what my ketones are, because once my body's burning ketones, then those symptoms that you may feel with not having enough sugar on board are not as pronounced. So let's go ahead and let's do that right now. I'm going to hop over and show my meters. As you know, I have a Contour that checks blood sugar. I have a Keto Mojo that checks both blood sugar and also checks ketones. So let's go ahead and we'll start by getting a strip into the Contour. So we'll see what my blood sugars are here on the monitors. What do you think my ketones are going to be? Okay, so once again, 93 hours of fasting. Tell me, what do you think that's going to be? And then let's go ahead and get a Lancet. And I've got to make sure I get a good stick tonight, because last night, remember, I had to do multiple. I don't want to have to do that again. And did I get a good one? I hope so. Yeah, there it is. Sometimes when you, and I use kind of the same fingers, y'all, to get when I do my finger sticks, and sometimes the fingers will get a little rough and calloused. And so you have to really get in there to get a drop of blood. And so blood sugar right now, 50 from the Contour, 48 from the Keto Mojo, 58 from the Libre, and 59 from the Dexcom. So all of them kind of relatively close to each other, within 10 points of each other. Let's go ahead and get this strip out, and let's get the ketone strip in. And go ahead and get that started. And just like I always do, I'm going to tease you guys, because I'm not going to show you what that is right away. And so go ahead and put into the chat or in the comments, what do you think the ketones are going to be? All right, so let's go ahead and let's hop over, and we're talking about indigestion during fasting. Indigestion during fasting. So what is indigestion? So indigestion is, or dyspepsia is the other name for it, is discomfort or pain in the upper abdomen or in the chest, right? Because it can move up, accompanied by bloating, belching, and nausea. And people tend to associate that with different types of foods, right? In the case of fasting, some of the common symptoms, and there you see them: bloating, heartburn. That's another way people describe it. Feeling like there is something like coming up into your chest, belching, and then of course stomach aches and stomach pains. How do we prevent indigestion? We prevent it by staying hydrated, avoiding trigger foods, and breaking the fast gradually. Right, so those are all things that we can do in terms of indigestion. That last one, of course, is now you're coming out of the fast, but during the fast, staying hydrated, and then avoiding trigger foods when you do eat, because sometimes the things that we do prior to fasting sets us up for indigestion. What are some causes? So empty stomach, right? The empty stomach is there, and so the body may still be making acid, particularly if you are new to fasting. The body has not yet learned that it doesn't have to make all that acid. Dehydration, just mentioned that, right? Refeeding syndrome. So post-feeding, if you don't do a good job of getting back into eating, then that can cause some indigestion or dyspepsia. And then, of course, the choices of food, things that are highly spicy, things that are trigger foods for you, can cause all those things to begin happening. And then how do we manage it, right? So we can use ginger tea, and ginger tea helps to soothe the stomach and reduce nausea. Peppermint tea is another one that may relieve bloating and stomach discomfort. And then, of course, apple cider vinegar. This can help to balance the stomach acid. And this you want to dilute a small amount in some water, and that will help to relieve some, or can help relieve some of those symptoms. And so those are some of the things you can do for fasting, when you're fasting and you're having indigestion. Okay. All right. Let's hop over and let's take a look at what my monitors are saying, and I have my Dexcom Clarity app that's up. Okay, and if you have not already done so, make sure you go back and watch our show this past Monday night on lab results for people who are diabetic, and results that your doc should and you should probably discuss as you are dealing with your diabetes. All right, so here is my monitor or my report, and you'll see there that my average blood sugar is 93. That's for the last 14 days. If I pop that back to 90 days, it's probably going to be maybe 104. So 104 there. And I'm in target 90% of the time. And if I look at my daily graphs, we'll see here in just a minute. And of course, I want to go back and take a look at what it was Monday morning. So Monday morning about 1 o'clock, we're at 119. 24 hours later, we're in the 80s. 24 hours after that, so we're now 48 hours. We're in 83. And then Thursday morning, so right now, that is in 72 hours, 70s. And of course, I don't have for now, but we've been running below 70 the whole time, okay? And so that's what those numbers are, and that's what they're showing. And let's hop over and let's take a look and see what my Keto Mojo is showing. So let's pop that over and we'll see it says syncing. And so it begins to pull that information over. So 48 was the blood sugar and 5.6, look at that, 5.6 is the ketones. Okay, 5.6 ketones. Now you'll see there the turquoise line, those are ketones, and of course the tan line, that is blood sugar. And as my blood sugar has gone down, my ketones have gone up, which is what we would expect. And ketones that are less than 0.5 considered normal, 0.5 to 1.5 considered nutritional ketosis, and then above 1.5 considered therapeutic ketosis, right? So if you guess what my blood sugar was going to be, amazing. Thank you for guessing. Thank you for playing. And so what am I going to break my fast with today? I have a salad, right? You guys know that I love salad. This is one that I created or I had from work. I got it, brought it in, stored it in the refrigerator. And let's go ahead and I'm going to, you get to see me eat that here for the first time. First bites in over 90 some hours. I love the crunch. So good. Delicious. So I'm going to keep eating that. But just wanted to say that I'm excited to be with you. Excited to be here. Excited to be able to come on and spend another amount of time talking with you about fasting. So many benefits to fasting. Remember, it's not just for improving blood sugars. It's improving your insulin resistance and your weight and your metabolic syndrome and all those different things that can occur. But glad that we got a chance to spend some time with each other. We'll come back and we'll talk more about fasting and all the benefits that you have as we move forward. Hey, y'all. Just want to let you go. This is Dr. Dwain Woode. That's Wood with an E. The E stands for endocrinology. Here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life. Avoid complications. Go to the next level. And in this year, new you, we will see you at a check-in tomorrow, even though I would have broken the fast, and then on our show Monday at 7 p.m. Central. Thanks for being with us. Good night, everyone.